Hello and welcome to the latest Q&A session from Telford Wrekin Council. We seem to be doing this quite a lot, and every time there is a significant change in the situation regarding the coronavirus pandemic. And the latest big change, of course, came in the form of the Prime Minister's statement to the nation and the subsequent press conference on Saturday night. And the key points that were made at that time were that a new Tier 4 for London and parts of the southeast was created. For Tiers 1, 2 and 3, Telford and Wrekin being in Tier 2, Christmas bubbles can continue with up to 3 households able to meet, but for only one day, and that only day is Christmas Day. Stay local, and people should not travel into or out of those Tier 4 areas, and all of that will be reviewed on the 30th of December. Separately, and soon after, the Welsh Assembly announced what they describe as a level 4 and put the country into lockdown. My name is Chris Kowalik and I'm hosting this latest Q&A session, and on the panel to answer your questions are Liz Noakes, Director of Public Health for Telford and Wrekin, Helen Onions, a consultant in public health, and the leader of Telford and Wrekin Council, Councillor Shaun Davies. Hello to you all, and I'll start off with Councillor Davies. On Saturday night, after the Prime Minister and a couple of others gave their statement to the nation, and while many of the rest of us were then watching Bill Bailey win Strictly, you were having a meeting with Robert Jenrick, the Secretary of State for Housing, Communities and Local Government. What was said there?
Thanks, Chris. And firstly, I just wanted to say that this is a huge development for the country, and we do need to make sure we're all taking it very seriously. At that conference call with the local government secretary, we were told very clearly that this new strain of the virus was everywhere within the country, and we should therefore act and plan on that basis. And what we do know about this new strain of the virus is that it's very, very transmissible, up to 70% more transmissible than the original virus. And that means that if it's here in Telford and Wrekin, and we think it probably is, then it will grow significantly over a very short period of time. So we are working on the basis that it's here, and we are asking residents to work on the basis that it is here and therefore act accordingly. What we've seen from other areas of the country is this is a rapid growth situation. So numbers of cases doubling within less than 7 days, which is very significant indeed.
I'll bring the other two, and at this point then, Shaun, you said we have to assume that it's here. There's a suggestion there maybe. Is there any evidence that it already is in the county of Shropshire and indeed in the borough of Telford and Wrekin?
In terms of numbers, we haven't got any specific numbers as yet in terms of this, but Shaun is right in terms of the national advice is to assume that it is in every area and to act accordingly. So our rates are currently at 270 odd cases a week, 150 per 100,000. We're monitoring that very carefully. But clearly, in terms of some parts of the southeast, they have actually seen a 50% increase in cases on a daily basis.
Going back to Councillor Davies, by the way, for the purposes of the audience, that's Liz Noakes, the Director of Public Health for Telford and Wrekin. Going back to Councillor Davies, since that meeting with Mr Jenrick on Saturday, what else has happened since then?
Well, as a council, we've been pushing on two fronts, really. The first front is around the vaccine. I'm very frustrated how long it's taking to get the vaccine out to Telford and Wrekin residents. I know lots of residents have contacted me, also very concerned, because there are vaccination hubs right across the country. We know that 500,000 vaccines have been administered already in England, but our numbers are hardly getting anywhere near triple figures right now. I'm delighted to say, hot off the press really, that we have now had confirmation that vaccines through GP surgeries will start in small numbers ahead of the new year, with those numbers then increasing into January. And it's very important, two important points. One is that the over 80s will be the first to be contacted, and they will be contacted directly by the NHS and should wait for that contact to come. And also, secondly, that NHS workers and care workers will also be provided vaccinations. That's really important because the Health Secretary was saying over the weekend that Tier 4 restrictions are likely to stay until the rollout of the vaccination. At the moment, we are on tier 2. I expect, and I don't think I'm breaking any confidences in saying this, I expect there will be an escalation of tiers for all areas of the country in due course, which also will, of course, cover Telford and Wrekin at some point. And if the exit strategy away from tier 4 is vaccinations, we do need to get on with rolling that out to our 7,000 residents who are over 80 in Telford and Wrekin.
Is that just another way of saying what we think is going to happen anyway in January, and that's a lockdown?
Well, we've had nothing confirmed, Chris, at the moment, but I think most people will have seen the speculation. If the numbers increase as they have elsewhere in the country, I can see that happening ahead of the new year, or certainly within January. The second front, Chris, I've been fighting on with my team is around business support for hospitality and hospitality specifically, but also retail and events too. We know that this is the busiest time of year for retail, hospitality, events companies, and so on. And in many cases, those types of companies make enough money in December to get them through to Easter, and that isn't going to happen now. So the government do need to reassess urgently ahead of Christmas the government grant scheme that's available for those companies, because quite frankly, the money that's on the table from the government is a drop in the ocean. So we do need to have a focus on lives and saving lives and protecting lives, but we also do need a dual focus on protecting livelihoods and businesses too.
We're going to go into all of these individual areas, talking about hospitality, the rules, vaccinations. But as Councillor Davies had only just mentioned now, the fact of vaccinations coming into the borough. Liz and Helen, how would people go about getting that vaccination? Are they invited to have it, or do they have to do something in order to get it?
They should wait for their GP or the NHS to contact them in order to make an appointment. They don't need to contact the NHS direct themselves.
Okay, and what is the order in which that will happen? Who goes first? Who's at the front of the queue?
The 3 priority groups at the moment are over 80s, healthcare and social care workers, and care home residents will be coming on stream shortly.
Okay, thank you. We'll go on to the questions as they currently are. Thank you for all of those questions that have been submitted since we publicised the fact that we were doing this Q&A. We publicised it from yesterday. So these questions that we're asking first are the ones that have come in prior to us going live at midday, only 8 minutes ago. Please do submit your questions in the chat on Facebook. We're also broadcasting live on YouTube. The channels for both platforms are /Telford Wrekin as one word. We do have people monitoring those questions, and they will be fed through to us, and we'll go through the questions coming in here and now after we have gone through after we've gone through the questions that have been submitted in advance. We'll start off by looking at the general rules then over Christmas. I started this session by reiterating what the Prime Minister said on Saturday evening. Now the specific questions, some of which I know we've answered, but let's go through them again. Can you tell me, please, if someone has to work on Christmas Day, can they have their celebrations on Boxing Day instead?
So this is an area that I'm sympathetic to, and we are pushing government for guidance on this. At the moment, my understanding is that certainly last time I looked, I don't know if Liz and Hannah can update us on any developments, is that that isn't the advice is that it is just for Christmas Day. So if you are working Christmas Day, then you would not be able to use that time on Boxing Day other times. Now, I am very sympathetic to this because I think that care workers and people working within the public services in particular, police officers, blue lights people, people on the hospital wards should not be punished for doing so. However, this is a piece of government legislation and guidance, and at the moment there is no mechanism at all for this time to be passported to a different day. We're also trying to understand from the police what their approach will be in respect of this. But at the moment, I'm afraid everybody that the government has said that it is Christmas Day and Christmas Day only.
You've used the words legislation and guidance in that answer. As it stands, is it law or is it guidance? And if it's guidance, then is there a punishment?
So it is law, it is guidance, and the police have got coronavirus powers to enforce those rules. Clearly, the two things are interchangeable in the sense that there's the law that of the land, but there's also then guidance that follows that. So, you know, I think this is an area that we are, as a local government community, pushing the government to give us some clarity on, because I think it is really important that they come out very quickly and say yes or no. I'm personally very sympathetic to it, but of course I don't make the rules in this regard.
All we can do is try to explain them, I guess. The next question then, can I travel into a Tier 4 area to see my relative who is in a care home?
So the rules are that you should not travel to or from a Tier 4 area unless it's for the exemptions, which are work and education. In regards to care homes, our advice would be to contact that care home and understand from the care home what their advice is, because it might be they're not accepting visitors. At the moment, it is a grey area as to whether or not you could visit a Tier 4 area for a care home visit. If the care home is accepting visits, then of course we would say to you to follow their rules to the letter, and also to travel directly to that care home and do not stop anywhere else. And then once you've had your visit, to return back, again, not stopping. But as I say, very, very important to contact that care home to understand from them their rules and their regulations around this. Again, a very grey area, I'm afraid, at the moment.
And when we do refer to Tier 4, then we are also referring to Wales at the same time, aren't we?
Yeah, so London, large parts of the south of England, east of England, and Wales, and it's really important as well that people check before they even consider travelling to check what that local area is. In, as I say, Tier 4 area, you really should not be going to those areas.
And now we have the issue of support bubbles, though. The next question is, if you are in a support bubble already, as you're living on your own, can you then stay overnight at your support bubble's home over Christmas?
I'll ask Helen or Liz to pick that one up.
My advice is that you shouldn't be staying overnight in another household. I know that's a support bubble, so my advice would be not to.
Nothing else to add? No? Just
No,
don't do it. Can you confirm if anyone from Tiers 1, 2 or 3 are allowed to travel into a Tier 4 area for work purposes? And supplementary question, just the same question but asking it far more explicitly. What if you work in London or Wales? Do you need to self-isolate then when you come back from your shift?
Right. So at the moment, and Liz and Helen can assist again here, my understanding is that you are able to go to a Tier 4 area for work. But if you can work from home, then you should work from home, and you should try and minimise the need to go to work. However, the government do recognise, of course, there are some jobs that you simply have to go to work. My advice would be that you then limit your contact with friends and family as much as you can, above and beyond what you should be doing in any event, because you are going to a higher risk area. Our advice to people who are arriving from a Tier 4 area in Wales to Telford Wrekin since the announcement is to self-isolate for 10 days and also to get a test. And Liz, no doubt, will want to say more on that.
Yes, Shaun. So I issued guidance in terms of anybody that's travelled over the last few days from a Tier 4 area or from Wales. We're particularly concerned about South Wales here, that they should isolate for 10 days. And if they wish to have a rapid test, they can book one at the Oaken Gates at the place. But even if that test comes back as negative, they should still continue to isolate for that 10-day period.
What's the concern about South Wales that you referred to there, Liz?
Because they've got a rapid, in some parts of South Wales, their case numbers are rapidly increasing in a similar way to the southeast.
And in terms of booking the test, that will be what, through our website?
I think it's on the website. We can put that in the information to follow. We've communicated that, and people are booking for tests yesterday and today and tomorrow.
And talking of websites where there is a lot of information provided by the council, there are two sites in particular. Take a look at telford.gov.uk/coronavirus and telford.gov.uk/health protection hub. So it's /coronavirus and /health protection hub. Can you tell me why there are so many people in the town centre ignoring the law and not wearing face coverings, and why there is no one in the town centre to enforce the laws, as even the centre security feel they do not have to wear them? If you want to keep the county in Tier 2, then can you not do something about the ignorance of people? Now, I do know that there have been officers from the council patrolling various parts of the borough, various town centres, including Telford Town Centre and the shopping centre as well.
That's right. But this is a police matter to issue fixed penalty notices, and I do know that certainly in the last few weeks, 17 fixed penalty notices have been issued in the town centre alone by the police. Actually, Telford Police are one of the highest issuing parts of the police in the country on fixed penalty notices, so they are taking this very seriously. And I think there is a personal responsibility issue here. You must wear a mask unless you are exempt, and if you aren't wearing a mask, you are putting yourself at risk, you're putting the community at risk, and you're putting fellow shoppers and workers at risk, and you really should be wearing one. However, if you are exempt, and there are lots of people exempt for very legitimate reasons, then they of course do not need to wear a mask, and often you'll see people who are exempt who will wear a card to indicate that they are exempt. But we are taking this very seriously. Clearly, lots of people, around 500,000 people over the last 6 or 7 weeks have been to the town centre, according to the shopping centres information, and the police are taking it really seriously. But there has to be a degree of personal responsibility as well as the enforcement angle here.
We're going into the subject of pubs. We've had some questions on pubs, and Councillor Davies, you said at the start of this Q&A session, you did talk about the support for businesses. We'll go into some more detail now in response to this question, which is, with pubs that are shut because of the restrictions, will they receive better financial support to ensure that they do not go under?
So this is a real area of concern for myself and for the team here at Telford Wrekin Council. That there are a number of, particularly what we call wet pubs, which don't serve food, that have been really hit by these restrictions. And even if you are a pub that's serving food, you're being hit too, because often people go out to the pub with their friends or their work colleagues, not people they live with necessarily. So all of these pubs are being hit. To answer the question, there is funding available. We are administering that on behalf of the government. It's based upon the rateable value of the pub premise. So, for example, if you've got a rateable value of between less than £15,000, then there's a grant of £667 every 2 weeks. Rateable value of between 15 and 51,000, £1,000 every 14 days, and a rateable value of over 51,000, £1,500 every 14 days. There's also been a Christmas support payment of £1,000 available to pubs that are simply wet lead pubs, which means they don't serve food. So if in doubt, if you are a landlord or a manager within a premise like that, please do contact the council. We've written out to a lot of these premises as well to let them know what available support we've got, and we want to get the money to them. But I do think there's a growing consensus across the country from councils that this support simply is not good enough, and it goes back to the point that the grants are modest anyway, but when they are making up money that pubs and restaurants and businesses rely upon for the rest of the financial year, then that is really, really concerning. And I'm really concerned that as we come out of this pandemic, and we will come out of this pandemic, there won't be too many pubs left over, and we do want to support pubs as much as we can.
What are the rules for pubs on Christmas Day? In particular, can 3 households, this would be the 3 households that would meet in someone's house on Christmas Day, can they meet in a pub?
So, unfortunately, the advice that we've received from government is no, that you can't. Now, for me, we don't make the rules, unfortunately, but we are here to explain them. But no, you can't. You can, of course, as you say, Chris, in the question, you can go around to each other's houses up to 3, but you can't go to a pub. And for me, that seems a bit odd, because I think that a lot of the hospitality sector have got a huge amount of enhanced support in terms of cleaning products and all the rest of it, and track and trace. But that is the government rule. There's no special exemptions on Christmas Day. So the rules that apply today in pubs will apply on Christmas Day too. Sorry.
Apologies, my computer muted me.
There,
it is. Does a substantial meal, this is the Scotch egg question, I guess, have to be consumed on Christmas Day?
Yes, it does. So all the rules that apply now also apply in pubs. But can I just say, so our public protection team are happy with me, that a Scotch egg alone would not be enough for a substantial meal. The advice would be there has to be some kind of accompaniment to that Scotch egg. For example, chips or salad or whatever. Again, unfortunately, we don't make the rules, and I'm sure that I can hear lots of tutting at home in regards to my answer there, but those are the rules that are there. So at the moment, you can't. Now, our public protection team are offering the advice to pubs for Christmas Day that a bacon sandwich, for example, would be a substantial meal. So if you wanted to do something, I know I'm very conscious a lot of pubs sort of open for a couple of hours on Christmas Day, often sort of earlier on. So a bacon sandwich, a breakfast food would be fine. But the substantial meal rule applies Christmas Day too.
The next batch of questions are all on the subject of vaccinations. Can you tell us where and when Telford will start the vaccinations on the population? Shaun, you broke that news because you had something appear on your phone just before we went live at midday. Just tell us again what you know.
So this is something that myself and the cabinet and the team here at Telford Wrekin Council have been very concerned about, because literally up until this point, we've been concerned that there's been a number of hubs, vaccination hubs outside of Telford Wrekin, but the numbers benefiting from the vaccinations have bin very small indeed in Telford Wrekin. So we are aware of 2 things today. So the first thing is that TELDOC, who are obviously a large GP practice, will start deploying their vaccinations ahead of the new year, and around 7,000 over 80s who are in Telford Wrekin will start to receive those letters now. Other GP surgeries no doubt will follow. And we have also been supporting the NHS as a council, because it's the right thing to do, to look at ways in which we can rapidly get out the vaccine once it's here in big numbers. And we're working very closely with them to do that. But the really, really important message is you will be contacted by the NHS when it is your turn to go and get the vaccination. And that is really, really important. The rules about who gets it and when will be done nationally, so we have no local control around that, but you should go and get the vaccine once you receive notification from your GP. I hope that answers the question.
And possibly answers the subsequent questions. I'll go through them anyway. They have been asked, so I'll ask them. When will older people and vulnerable people be getting vaccination? And then very specifically, could you please give me some idea as to when my 91-year-old mother who lives in Newport will be offered the vaccine? Many thanks from her concerned daughter.
Yeah, of course. So go back to my point. The vaccinations have started in very small numbers. We know that, very small numbers. Those are going to start to increase as the vaccine is administered through GP surgeries. After that, we're looking to support, as a council, looking to support the NHS with rapid rollout of vaccinations, either the current one which is being used or any of the other ones that are going to come online, hopefully in the coming weeks.
And acknowledging a further question, already answered, but we'll just acknowledge the question. This was the lady in Wellington who says she's over 80 years old with kidney and liver genetic disease. She also was asking when would she be getting that vaccination. You'll be contacted, you'll be told. Can you keep us updated on the vaccination rollout in Telford, please?
Absolutely, yes, we will. And I think Heather wants to come in at this point.
I just wanted to say Liz has described the process for invite and you've outlined how the programme's working, but it's really important that people take up that invitation when they receive the invitation. Some of the questions coming through are from people really chomping at the bit to get the vaccine, to get their families covered. but actually some people might be more reticent. So it's really important to take up that offer when you get the invite.
There was mention nationally of how long it could take to vaccinate the nation, possibly a year, maybe even longer. What's the steer now, do you
Well,
think?
I think though I've seen that myself, Chris, and I think that that's all based upon the current supply of the current vaccine that's in place. And we do know that the current vaccine will, the manufacturing of that vaccine will scale up as time goes by, so that will shorten the position. We also do know that there's likely to be other vaccines that come on board, in particular the Oxford vaccine, which again will scale up and get the vaccine out quicker. But I think Liz will probably want to come in and say something more on that.
Thank you, Shaun. I just wanted to say in terms of actually the immunity so somebody has to have 2 doses currently in terms of vaccination, and in terms of it's only 1 week after your second dose do we think you've built up that immunity. So it's really important that people understand that it will take a month from the first dose to do that, and if we're having to do that across all the different priority groups, it will take some time to do that.
As a matter of interest, a question from me now, so it's not in the script, but if the vaccinations happen in 2 parts, 21 days apart, what happens if for whatever reason that second appointment doesn't or can't happen, that second vaccination doesn't happen on schedule? What happens then?
Well, Liz will probably want to answer in more detail, but
the NHS will deal with that situation. You should approach your NHS in terms of the details in terms of that.
But the key point is, without the second vaccination, it's effectively either ineffective or significantly less effective than it would be otherwise. So it's really important that people keep their appointments with NHS, just like you would a GP's appointment. It's really important you keep that appointment, and if you can't make it for whatever reason, then you contact the NHS to make alternative arrangements.
From vaccinations to testing, and a question has come in on someone wanting themselves and their 2 sons to have a quick result COVID test before Christmas Day, so not long to go now. Where can they go, and how do you book that test, please? This will be the Oaken Gates Theatre then, won't it?
So rapid testing is available at Oaken Gates Theatre, but we have opened it up and have targeted groups, so it's not mass testing and open access to all that some members of the public might have seen is happening in tier 3 areas. So it is by appointment only and targeted groups at present.
As someone who has just been to the rapid testing centre, they're unsure if they have to isolate if their test comes back negative. They've been to Wales. Can you advise them?
So my advice was for anybody that has travelled back from a tier 4 area or from Wales, that they should isolate for 10 days. They can get a rapid test, but even if that comes back negative, they should still continue to isolate for that 10-day period.
In Chris, I'm sure Liz and Helen will agree with me on this, that the test, I've heard a lot of people say, oh, what I'll do, I'll go and get a test sort of the 23rd, 24th of December. That will then make sure if it comes back negative, I'm fine. But that is completely wrong. The test result only gives you the test result there and then. You could get infected walking out of the testing centre. So it's really important people do use it as an indicator, of course, but also they then continue to take precautions. It's not a free license to operate as you want to, and in particular the tests that are taking place, the 30-minute tests. We do know that the accuracy of those are around sort of 70 or 80%. So they are an indicator. They're a part of the armoury that we have as a country and as a council, but they are not a golden bullet, and therefore we really urge people to be careful even after test results come back.
Absolutely, Shaun, and especially with this new variant, that we should be redoubling our precautions, and therefore a negative test from a rapid flow is only valid on that day, and as you say, you can pick up the virus exiting the test centre or with your family later on.
Another point there also is a negative test wouldn't release you from any self-isolation period that you were in. so it can't be used to release you either.
We're going into the questions now that are coming in while we're speaking, so they're in all sorts of order, but we'll do the best we can. Can I ask why there are track and trace personnel in stores not wearing face masks while this questioner is out shopping?
Well, I clearly don't know the individual circumstances of who those people are, or why they're doing that. So
there's another question that goes into a bit more detail. I'll spare the names, no names, no pack drill, but somebody went into a supermarket last week, 5 members of staff asking customers to wear face masks, but only one of the 5 members of staff had a mask on themselves.
So the answer is that people should take personal responsibility for wearing a mask. There are lots of reasons why individuals may not wear a mask. So, for example, if they are exempt, or if they've got another good reason. My advice in those circumstances would be to report that to us. We do visits to businesses alongside the police, and of course, in that circumstance, the supermarket's been named there, a large supermarket. I'm sure that their HR or their customer complaints team would also want to know about that. But again, it's very difficult for us to sit here and answer specific circumstances without knowing the full set of details.
Can you know if there are any new walk-in quick testing centres due in Telford and Wrekin to try to pick up asymptomatic cases like they are doing in Liverpool?
Liz will answer the question in regards to further walk-in centres, but I think the really important point about Liverpool is that Liverpool was part of a national pilot which involved 2,000 army personnel, and it also involved a huge amount of national effort going in to test the concept of mass testing. Mass testing is only available to tier 3 areas, and even in those tier 3 areas, actually the scale of the Liverpool offer has not been repeated in any other tier 3 area. We are only in tier 2. So therefore you can see how far down the pecking order we are really from a national resource point of view. My clear advice is that we have huge amounts of capacity here in Telford and Wrekin already through our walk-in on our drive-through testing facilities. If you've got any of the classic symptoms, then please do go and get a test, however mild. If you've got any of the pre-symptoms that our council and Liz will touch on in a moment, go and get a test. And if you are in a position through your workplace or your circumstances where you're being offered the opportunity to go and get a test at Oaken Gates through the rapid flow, then please do that. Please don't think that we haven't got enough testing capacity, because we absolutely have. I've been required to go and get a test. Lots of people are, and I got a test result back within 12 hours. Now that's just going through the government framework of testing. So Liz, I don't know whether you want to pick up on and expand on that.
No, I mean, you said all I needed to say, really, Shaun. Certainly, there is testing capacity within the borough. If you have the classic symptoms, you must get tested. If you have any of those precautionary symptoms, you can get tested, and I would encourage you to do that. And then for the rapid testing, which is testing, we're targeting that, and we're trying to test people that have no symptoms. We've got so far got one centre at Oaken Gates. We haven't planned another centre currently, but we're seeing in terms of how we can mobilise that in other ways in the future.
And going back to the point made only a few moments ago about having the test and then the possibility of maybe catching the virus afterwards, because the test result is a moment in time. A questioner asks, a lot of people aren't following these rules. As soon as they get that negative test, they go back out into the community, which is clearly causing spread. The question itself is, what can be done about this to protect the vulnerable?
So this is a matter for police. The police, there is now a legal requirement to self-isolate, and therefore, if people are breaching those rules, then that is a matter for the police. And we'd ask people to consider reporting people who are blatantly breaking the rules to do that. But we also know, and unfortunately, the messaging around this is very confusing. I'm being contacted lots by residents who genuinely, and the vast majority, I've got to say, the vast majority of people are following the rules. They want to follow the rules, but there is a huge amount of confusion because of the mixed messaging from government and the constantly changing government messaging from government, and that is something I'm really sympathetic about. So I genuinely don't believe there are too many people here in Telford Wrekin that will want to consciously and actively put people's lives at risk. I think that there will be a small few that should be dealt with robustly by the police, but the vast majority of people will want to follow the rules. So if in doubt, check what the rules are. And if you're confused or you are unsure, then please do contact us here at the council, and we'll do our best to help you. Liz, I don't think whether you want to add anything to that.
No.
Going back to a comment made earlier, the question just come in. Do you know if we have the new variant in Telford? It has been said in this conversation that you have to assume it already is.
Yes, it's highly likely that it will be here in Telford Wrekin, as it is highly likely to be in every part of the country.
The Home Secretary said on TV this morning, asks the questioner, that people should stay at home, yet the council is encouraging us to shop local and eat out. Shop local is a phrase you've used a lot, Councillor Davies. How do we know what to follow?
So the rules around stay home now have been much more enforced, haven't they, since the new strain and the government's response to the new strain. We are in tier 2, and all of the rules are set out by government in regards to tier 2. At the moment, we continue to be in tier 2, and that's the government's decision. We don't make the decision about what tier we are in. However, what we're doing, and part of this today is about this, is saying to people, you really, really do need to be more cautious now because of this new strain. I've already said that I anticipate there will be an escalation in tiers right across the country, including Telford Wrekin. That is a government decision to be taken. I'll also just say that we've always been very clear about shopping local and eating out in a COVID secure way. And that's really, really important because this is about lives and livelihoods too. The final point I would make is that the last time we did one of these Q&As, you'll remember, hopefully, if you watched it, about the questions around Christmas. And we, as a council, were very cautious about what the rules were around Christmas. And we were saying to people, just because you can doesn't mean that you should. You might remember the analogy that I gave around the 30-mile-an-hour speed limit. Just because you can travel at 30 miles an hour doesn't mean you have to. You reduce your speed depending upon the condition. So we do have to follow the rules that are set nationally by government, but we do try and provide as much advice and support as we can as a council to do that in an appropriate way.
A question has come in regarding the vaccination within the care home settings. The questioner asking why it is that the staff and management of care homes are being vaccinated, but not the residents.
So this one for Liz.
So the residents will be vaccinated. It is more complicated in terms of the fragility of the vaccine, but I am aware that there are some firm plans now in place to commence immunising in some care homes in the very near future.
Talking about schools, a couple of questions in relation to the new variant and schools. With the new variant, will we still be fined if we don't send children to school? And then the second question is, it's just been announced on the news this morning that the new strain of the virus is and will affect children. So what will happen when schools reopen in January?
Okay, so the first point is that secondary schools, it looks certain now that secondary schools will not return as normal and as planned, and there will be a phased virtual return to schools, seeing a hybrid model of learning, virtual and physical, and we're waiting for government to explain to us more about that in the coming days. And people may have seen that fellow council leaders in London, in Greenwich and Islington, friends of mine, Richard and Danny, wanted to close their schools earlier because of the specific issues that they had in their boroughs, and were prevented from doing so. So we do know this is an evolving story. We also do know that the government has an aspiration to get mass testing into schools. I've got some concerns about how that's going to work and how that's going to operate at scale, but we're waiting for the details of the government. But what's been made very clear to us as councils is that it's not our decision as to whether schools open or close. It is a decision from government, and we've also seen over the last couple of weeks that where councils have tried to take precautionary steps and close schools early, the government have then threatened to take those councils to court for doing so. So we do need to watch this space. Clearly, we've got a couple of weeks now of the Christmas break left, but the questioner is right that the early evidence, as I understand it, is that in particular there is some suggestion that new variants has been more active within secondary schools in the south of England. However, that's really early days, so we need to wait and see for the more analysis to come through from that. But my advice also would be that COVID as a virus throughout all of this pandemic has affected children in the same way as it has affected adults in terms of catching it. But I'm sure Liz will want to put some more detail on that.
Just to clarify that I've got no evidence that the new variant is more transmissible in one age group compared to another, but it is a rapidly developing situation in terms of what evidence we have got. So I wouldn't say that that's the case around school children at the moment. I think we should all be cautious, and this new variant is a risk to all of us, not just one group within our community.
Helen Onions?
I just wanted to come in on the new variant for schools and with businesses, really, that through the Health Protection Hub, we're talking to head teachers throughout the day and out of hours as well, and have a really strong relationship with them, so we can pick up on any new infections straight away and not wait for the national system to tell us. So we want to just be absolutely there to find out when and if cases surge with this new variant. And also with businesses, we've sent out a circular to thousands of businesses to over the Christmas period be really, really vigilant and let the health protection know around any increasing infections, so we can act straight away. So our local relationships are going to help us look out for what's coming, I think.
Just going back to the point on schools closing, Councillor Davies, you were speaking that it's a government decision whether or not schools en masse close, but there have been scenarios on individual cases, haven't there, in the past this year where it's not feasible for any individual school to carry on, and therefore that school will make its own decision to close, won't it?
Yeah, and that's more often than not linked to staff capacity or the need for deep cleaning, and that would be an individual head teachers and governing body decision based upon the advice of the Health Protection Hub. But in terms of delaying schools going back or closing schools en masse, as you say, the government have told us very clearly it's not our decision, it's the decision of government. And when councils have tried to close schools early because of a concern around the new variant, in particular schools within the south of England, the government have taken a very robust action and tried to take those councils to court. So this is a government decision about the opening and closure of schools.
You mentioned people coming into Telford from Wales, but what about those coming in from the southeast, Tier 4? Does the rapid testing and isolating include them? I think we covered this earlier on, but let's reiterate the answer.
Absolutely, yes.
Yes, it does. Tier 4 and Wales.
On to the bread and butter of parking and car parks. A couple of questions on this one. Why will the car parks become payment again from the 4th of January? And indeed, some of the free car parks, which haven't had the time limit on them, the time limit will now start to apply from that same date, won't they? And are you going to have sanitizers on those machines that produce the tickets, whether they're free or you have to pay for them?
So at the moment, I mean, we're very lucky in Telford Wrekin. We've got the vast majority of our car park spaces in our district centres are free. That's not the same in other parts, most parts of the country, including in Shropshire. Where car park charges have been applied, we've taken an individual decision around the suspension of car park charges, and we'll keep that under constant review, in particular with any developments that take place over the coming weeks from government. In regards to sanitising, that no, we won't be providing sanitiser at car park machines. We'd expect and anticipate that you would be able to take your own sanitiser to use, but we do have I can't say the word contactless payment available in most of our facilities.
Question about supermarkets. Why are they allowing so many people in? The questioner here was in one particular supermarket yesterday, and it was heaving. Now, back in the spring, there were people on the doors, and there were long queues going right around the car parks, everybody standing 2 meters apart, and only a certain number of people were allowed in. Since then, some supermarkets have developed a traffic light system at the doors, but it would appear, certainly from this questioner, and I've seen it myself as well. I've been in some supermarkets, and it is a lot busier, and it's appearing to be allowed to be a lot busier now than maybe it was back in the spring.
So it's based upon the capacity of the supermarkets or shops are worked out using a national formula. If there's any particular concerns about any particular shops, please contact the coronavirus at telford.gov.uk, and we'll be more than happy to send some of our enforcement and team to have a look at the situation.
Just to reiterate that email, that is the email address for the public protection team on all matters regarding the enforcement and compliance with coronavirus regulations, restrictions and rules. That's coronavirus@telford.gov.uk. My mother lives alone and is in a bubble with me, coming to myself and daughter for Christmas Day, and was going to stay the night. That's what she was going to do. Is she still able to, in a bubble?
So the rules apply just to Christmas Day and not over the other days. But I'll ask Liz or Helen to answer the question in regards to the support bubble element of the question.
I mean, my personal advice would be to avoid overnight stays, even within bubbles. I think I said that previously, so I would continue to say that.
A similar question regarding an 89-year-old mother. But the point is, she feels isolated, and the questioner is worried about her mental health if we now tell her that she can't come to us. Now, that is a significant issue, isn't it? It's the other problems that people can experience. It's not just COVID, is it? It's adherence to the restrictions and the other effects it can have on people.
Absolutely, Chris. And this is not just coronavirus is not just about the virus. It's the impact upon the virus in many ways, and mental health is an issue. Is something that is really concerning. And there are agencies and organisations available. I would really say to the questioner to maybe, and I'm sure she already has, contacted her mother's GP just to see what support's available. But the Christmas Day situation is obviously the rule around when you can see each other, but coronavirus doesn't recognise Christmas Day, and therefore for coronavirus it's like any other day, and therefore the virus will transmit. And what's on top of that, according to the government, is that this new strain is even more effective of transmission. So it is really dangerous. It is about balancing risk and balancing the situation. But as I say, in terms of if you're living alone, you are able to have a support bubble, and therefore you are able to exercise the rights under that support bubble. I think the point that Liz is making, I'm sure Liz will speak for herself, but is just to be absolutely really careful, uber cautious, and look at the advice that can be taken. Things like opening a window or something, or a door, and you're keeping the room full of fresh air is really important. PPE, 2 meters rules, washing hands, all those types of things we know. But Liz, I think it's a very specific question, probably around the support bubble, that people are looking for some advice on.
I mean, I think in terms of the advice in terms of tier 2 support bubbles is that 89-year-old mum can visit her daughter and spend time with her in her house. She's part of that support bubble. So my father is part of my support bubble and does see me on a Sunday afternoon, and that is acceptable. What I was concerned about was the length of time that they were planning to spend together and the overnight stays, and that the Christmas gathering is just for one day only.
What help is there in relation to mental health?
Go on, Liz.
I mean, there's various help available. I think there's information on our website, and certainly we can put information around some of the community and voluntary sector groups that are available to support people.
A question from a health and social care worker who says should be vaccinated in phase 2, but hasn't had any information on receiving that vaccination. What can they possibly expect, and when, do you think?
I mean, in terms of, is this a healthcare worker or a social care worker?
I'm a health and social care worker.
Okay,
is
so
the question.
I know social care workers, care home workers have registered to start to get appointments at the hospital, and indeed some of our residents have been vaccinated at the hub in Shrewsbury, but in a sense they need to wait for the NHS to release the appointments that they can have.
It's quite a specific question that's come in relation to wheelchairs. As a user of a wheelchair that's 4 feet in length, does the 2-meter rule start from the footplate or the outside of the rear wheel, given that the sitting position of a user is in the middle of the back wheel?
It's a very complicated and niche question, so we might want to come back to that resident in more detail about the specifics. But the basic rule of thumb, of course, is it's 2 meters from you as a person. It's measuring that 2 meters from where you are rather than where the parts of the wheelchair is. But if that resident wants to contact us, we'd be more than happy to discuss that individually.
Just going back a question for this has just come in. It's going back into the phase 2. My sister works in health and social care, but in an office, and that's already been offered. But the questioner herself works in a children's residential home mixed in with lots of households. So the office worker has been offered the vaccine. They offered the vaccine under phase 2, but the questioner who works in a children's residential home mixing with lots of other people hasn't.
I mean, I think these are questions that the NHS need to answer in terms of the priority groups, but certainly the key priority group for care home workers was in older people's homes in the first instance, I think.
A point and a question directed at Councillor Shaun Davies, leader of Telford Wrekin Council. You've responded several times saying that in terms of enforcing the laws, it's a police responsibility. However, the questioner says the police are not in the town centre, the shops or the retail parks. Surely this is something that you can address with the local police authority and getting more patrols into these places in order to enforce the laws.
Yes, and absolutely, and I do, and we do. And this is a public broadcast, and I know that the police will be watching, but of course, as I always do at the end of these sessions, we'll feed back to the police about the concerns, and the police clearly are operationally independent from me. I can't force them to do it, but absolutely, I do say to the police all of the time the amount of concern that residents have in respect of non-compliance of the rules in various settings, but in particular the shopping centre.
With numbers still on the rise, why are you stopping the booking of gym sessions? It's so much safer to book, they say.
So I think this is a development from our leisure services team, and what they're looking to do is to manage the demand slightly differently. And I think if you want to sort of ring ahead and to say that you're going to be there and get a feel for demand, then I think that's fine. I think what they found was that the booking system sometimes meant that the gym was then left empty for quite some time without any use, and people were therefore being turned away when they were turning up. So I think it's about a different approach, a balanced approach. But of course, just contact your local leisure centre, and they will be able to assist you in terms of best times to go.
A question that we've been asked previously on previous question and answer sessions, and this is in relation to the reporting of COVID deaths within the Shrewsbury and Telford Hospital Trust. Any data has been, if there has been any data, it's been collectively on behalf of both hospitals. But again, the question is how many specifically at the Princess Royal Hospital and not a joint figure with the Royal Shrewsbury? What can you say?
Shall I answer? Helen? Yeah.
Yeah, I understand that it's been 125 at Princess Royal, and not all of those will, of course, be Telford Wrekin residents, but that's a hospital-based figure.
But we do have the number of deaths in residents, sadly, and so we've had 137 residents in total that have died this past year from COVID, 98 of which were in Princess Royal, and the remaining 39 in the community.
And can I just obviously say that each one of those deaths is an appalling tragedy for the family and friends concerned, and nobody wants to be counting more deaths in any set of circumstances of people who are unfortunately dying from this virus. But it does really underline the issue here that this is a deadly virus that does not discriminate. Once it's inside your body, it's how your body responds to it, and therefore we should all be taking this very, very seriously indeed. Of course, it's not just deaths within the PRH, but also within our care home settings, within the community, and elsewhere. And I sometimes think we've got to a point as a country where we're seeing the rolling total of deaths every night on the news at 6, and we kind of are almost becoming mute to it. But actually, close on 70,000 people have died. That's half the population. Well, approaching half the population of Telford Wrekin that's died from this virus, and that is huge. And that's just on the official figures. Of course, there's a number of other ways in which people are counting deaths. And as we spoke earlier on to Chris, it's not just about coronavirus deaths as well. It's also about people who are unfortunately passing away from not being diagnosed with certain health conditions, the impact upon mental health. So this is really, really serious situation.
Onto a completely different subject. The question reads, how does Councillor Shaun Davies intend to support the families affected by the baby scandal at the Princess Royal Hospital? Now, this is in relation to the independent maternity review chaired by Donna Ockenden, known as the Ockenden Review. It's investigating 1,862 maternity cases at the Shrewsbury and Telford Hospital Trust, and earlier this month it published its initial findings covering the first 250 cases reviewed. Some of the findings included poor risk assessment, poor monitoring of fetal heart rates, failure to escalate care to more senior clinicians, and a culture of keeping low rates of caesarean sections. It called for immediate and essential actions to improve safety in all maternity services, not just at South, but across England. And so the question being, how do you intend to support the families affected by this scandal?
Well, of course, I'm just start by saying that I was personally moved by reading that report, and of course the council has read it and have sought to understand it and sought to ensure that we can do all that we can to make improvements to our hospital trust here in Telford Wrekin and wider Shropshire. And it's really important, it's critical that the recommendations within the report are immediately enacted, and there's a set of essential actions that need to be taken ahead of any other report coming through. There has to be cultural change at the SAF. There has to be lessons learned rather than a defensive strategy in respect of this. I've been raising this issue privately with SAF for some time, and also with the CCG, the health bosses, to ask them to ensure that there is a huge amount of support available for families affected by this, whether that be through advice, guidance, or talking therapies, or signposting to various support services. And I'll continue to do that. If there's any member of our community that have been impacted by the Ockenden Review, or are taking part in the Ockenden Review, who wants to speak to me about this, I'm more than happy to arrange that meeting to see what support we can offer as a council. But it is absolutely essential that the NHS learn from this. It goes without saying, as somebody who was born at the Wrekin Hospital, someone whose son was born at SAF, as somebody whose family for a long time have been being born in Shrewsbury and Telford NHS hospitals, it's really personal to me and personal to our teams that this is got right. I also think, finally, that this really is another sign of the investment that's required at Shrewsbury and Telford NHS Trust. This is not the first set of, unfortunately, uncomfortable reading we've had. We've had CQC reports, we've had health and safety reports into SAF that have been really, really concerning. And we do need to have a real determined action plan and rescue plan for our trust, so that we can get back to a situation where the basics are being done right. And I think that does feed into, and I will say it does feed into the listening of our community and our stakeholders as part of their decision making, and that includes things like Future Fit too. So I do really hope this is a wake-up call to staff and the wider NHS. And as I say, absolutely, email me please, shaun.davies@telford.gov.uk. If I can be of any assistance, I'm more than happy to meet with you.
And in terms of the Ockenden report itself, you can read the actual report and any further and subsequent updates from Donna Ockenden on her website, and that is www.donna, D-O-N-N-A, Ockenden, O-C-K-E-N-D-E-N, all as one word, donnaockenden.com. Let's begin to round up then, everyone. At the very start of this hour, an hour ago, when I rattled through some of the key points made by the Prime Minister on Saturday, he said that the Tier 4 review, the Tier 4 rules will be reviewed on the 30th of December as part of the wider review of all restrictions. What do you think will happen?
Well, I think what we saw happen is that when circumstances change, then the government then look to review the situation, and of course the Tier 4's areas were done ahead of that 30th of December review. I think in reality, and again, I don't think I'm breaking any confidences. I'm often criticised by some for being too honest and too direct with residents, but I think it is my job to do that. I genuinely do think there will be movement ahead of the 30th of December, which will affect every part of the country, including Telford Wrekin. If I was a betting man, I would say that the country will be in Tier 4 restrictions or something similar ahead of the new year, and if not the new year, then certainly sometime after. I think we all need to keep something in mind that just because we're in Tier 2 right now does not mean that we are somehow in a better position than areas of London or the south of England, because at the moment things are evolving very, very quickly. So please just remember this COVID-19 virus is a killer. It will kill. And it doesn't matter whether it's Christmas Day, it doesn't matter what setting you are in, it will kill people if people are infected. So take every precaution you can, and let's not have any regrets. From what we are being told, and we have to take that on trust. This vaccine rollout is coming at pace, and this time next year, absolutely praying here, this time next year things will look very, very different. So put those birthdays celebrations on hold. Many people have had to do that since March of this year for various reasons. Postpone them and have bigger and better birthday celebrations next year. And in terms of Christmas and New Year, let's just hope that 2021, the Christmas of 2021, is a time when we can all come back together safe in the knowledge that the vaccine has been rolled out. But let's not have any regrets this Christmas, and please take personal responsibility in regards to what's happening here right now.
And I'll leave the final words then to Liz. Helen, anything you want to add?
I would just like to say, echo what Shaun said really. Thank all the residents for this last year in terms of taking that personal responsibility, because I think the vast majority of our residents have done so, and it continue to do so. So a big thank you there. I am sorry that Christmas is not going to be the same this year, but it is a shorter, i.e. one day only, small Christmas is absolutely a safer one. With this new variant, we do have to redouble our efforts in terms of the usual messages in terms of reducing the number of people you meet, washing your hands regularly, wearing a face mask appropriately, and making sure your homes are well ventilated. But as Shaun says, there is hope at the end of this. The vaccine is being rolled out, and hopefully during 2021 we will start to see some return to normality. But this is not the time to take risks at this point in the pandemic.
Let's give the absolute final word to a couple of questions that have just come in. We said we'd answer them, and here they are. Can you please update Telford and Wrekin residents regarding the provision of the vaccine for those over the age of 80? My mother is 91, and the question is naturally concerned. It seems vaccines have been offered in Shropshire and neighbouring Staffordshire. We have covered this already. Let's just reiterate the point.
Yeah, absolutely. So first point is I'm really frustrated about how long it's taken to get the vaccine out in Telford and Wrekin. We've seen some development over the last couple of days where that is now starting to uptick, in particular GP practices starting ahead of the new year. And we will, and I will, absolutely make sure that we're putting Telford Wrekin forward at every opportunity to get this vaccine rolled out. And I think if you look at our track record in regards to the provision of things like walk-in centres and drive-through centres for testing, Liz and her team have done really, really well at getting our fair share, and we will be continually banging the drum to get this vaccine. We've got 7,000 over 80s that want this vaccine on the whole, and we want you to have that vaccine too, and we'll keep on pushing as hard as we can to make sure that we get our fair share of that vaccine. But your GP practice will contact you, or the NHS will contact you once it is your turn to go and get your vaccine.
And finally, a bit of a medical question. Do you think that vitamin D should be given to everyone to help protect the immune system against COVID-19?
I'm not specifically recommending that. I've not seen that in terms of the evidence. So, but I think everybody needs to follow medical advice in terms of if they need vitamin D for other reasons.
Thank you to Helen Onions, to Liz Noakes, Councillor Shaun Davies, leader of Telford and Wrekin Council, for the last hour and 6 minutes of answers, and thank you to you for your questions. I'm sure we will speak again very, very soon, but for now, stay safe and Merry Christmas.